Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to let you know that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type that in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you very much. Good morning, everybody. Glad you guys could join us. Happy February. The bad news is the groundhog did see his shadow, so unfortunately 6 more weeks of winter. I don't know about you. I was actually kind of glad to see some snow, not this much. I'm kind of over it. So, but glad you could join us today for our webinar. And wanted to remind everybody the Medicare Assistance Program is funded through grants from the Administration for Community Living, which provides us funding to go out and educate people about Medicare and what the different parts of Medicare are and how to best use your Medicare benefits, as well as how to protect yourself from becoming a victim of fraud in the Medicare system. So if there's anything that we can do to assist you related to your Medicare benefits, please don't hesitate to reach out and give us a call. So wanted to also remind you that we are currently in the Medicare Advantage open enrollment period. Now, as you know, we have the annual open enrollment period, which goes from October 15th through December 7th. That is when people are choosing to review their Medicare coverage, and maybe they want to look at Medicare Advantage plans and review their Part D prescription drug coverage every year. And any of the changes that a person makes during that time period become effective January 1st of the following year. But then we also have this Medicare Advantage open enrollment period that goes from January 1st through March 31st. And that is specifically for people who are currently enrolled in Medicare Advantage plans. And that's so that people can take a look at the current Medicare Advantage plan that they're enrolled in and decide, do I want to stay in this Medicare Advantage plan, or do I want to look at possibly switching to a different plan? Or do I possibly want to go back to traditional Medicare and enroll in a Part D prescription drug plan? So this gives them another opportunity to evaluate, is this the right plan for me? So it's something to think about. We do know that some people have received a letter from Integris Health Systems. They are still in negotiations with United Healthcare. And so they're still trying to work things out. If by chance those negotiations don't work out and they can't reach an agreement, those individuals who are currently enrolled with United Health who use Integris providers will have an opportunity to switch to a different Medicare Advantage plan. So I don't want anyone who is currently enrolled with United Healthcare that uses Integris providers to be upset or worried that they're not going to be able to use their doctor. You will have a chance because those My understanding is those contract negotiations have to be concluded by, I believe it's around February 7th or 8th. That would give you plenty of time to make a change before that deadline of March 31st. So be aware of that. Any changes that you make in the month of February would be effective March 1st. If you waited until after March 1st to make a change, those changes would be effective April 1st. But the deadline for making any changes during this Medicare Advantage open enrollment period is March 31st. But now let's get into our topic for today, and we're calling it Welcome to Medicare. But it's more or less, so what is this? We got a lot of people who probably retire at the end of the year. That seems to be a popular time for people who are choosing to take the plunge and go ahead and retire and go fishing. Take up a hobby, whatever they're wanting to do. And that's a time when a lot of people start their Medicare benefits. So we're going to talk about what that is. It's not an automatic thing. It's not something that just happens automatically, like not many things that do happen automatically, as a matter of fact. There are certain steps that have to take place before a person gets Medicare most of the time. So we're going to talk a little bit about that. So what is Medicare? Medicare is actually a federal government program that provides health insurance. It's regulated by the Centers for Medicare and Medicaid Services, CMS, and it's funded by several different sources. For one thing, us. The taxes that we pay out of our paychecks for Social Security and Medicare, those FICA taxes that come out of your check. Also, it's paid by premiums that we pay on a monthly basis. So for your Medicare Part B, you pay a Part B monthly premium. That helps fund your Medicare as well. Also, there is some money that comes out of the federal budget annually to help fund the Medicare system. Who is eligible for Medicare? Well, most of the time we think about people who are age 65 and older. With Social Security, that number is kind of a moving target. Some people start getting their Social Security at age 62. They take it out a little bit early. We know that the new age for people to start receiving their full Social Security benefits is age 67. Medicare isn't like that. By law, Medicare, the full Medicare age is age 65. It's kind of set in stone. So for most people, age 65 is the target age for Medicare. That's the age when people start receiving. That's when they qualify for that. Now, they have to be. I am so sorry. I got something that just went down my throat the wrong direction. I don't know where it came from. Probably dust. So they either have to be receiving or qualify for Social Security retirement cash benefits, or they have to currently reside in the United States and they're either a U.S. citizen or permanently reside in the United States and they've lived here for a continuous 5-year period. Now, some people are under the age of 65 and they've been on Social Security disability. They have to have been on Social Security disability for 24 months before they can receive Medicare benefits. Also, people who've been diagnosed for end-stage renal disease can get Medicare. It's kind of its own separate form of Medicare benefits, and that's kind of its own separate topic that we could cover in a different session. Now, it's also worth pointing out that people who have been diagnosed with ALS, Lou Gehrig's disease, also qualify for Medicare benefits. They do not have to wait that 24 months. They actually qualify to start receiving Medicare benefits the first month that they qualify for disability benefits. So that's something that's a little bit different there. So what all does Medicare cover? Medicare is going to cover medically necessary care and items, all right? So let's flesh that out a little bit. Medicare is divided into different parts. Medicare Part A covers things like inpatient hospital care. It also covers skilled nursing facility. That's that place that you can go to once you've been in the hospital for inpatient care, but maybe you're not quite ready to go home yet. You need to recover a little bit more, maybe receive some more therapy, something like that. Part A also covers home health care as well as hospice care. Part B of Medicare is sort of the outpatient coverage. It's going to cover things like doctor visits, durable medical equipment, things like wheelchairs, CPAP machines, nebulizers, that sort of stuff. It also covers home health, ambulance, preventive services, lab, x-rays, that sort of stuff. Now, there's other parts of Medicare that got added on later on. These two parts of Medicare have been around since the beginning, since it started in 1965. Part D of Medicare is really the newest part of Medicare, and that's what covers your prescription drug coverage. Part C of Medicare is the Medicare Advantage plans. And it's kind of its own. We're going to have a whole session on that later on this year. And it kind of encompasses everything. Medicare Advantage plans is another option for people to get their Medicare coverage. And it includes the benefits of Part A and B, and most of the time the Part D benefit, the drug coverage as well. What does Medicare not cover? And this is very important as well, because a lot of times people don't understand this very well because we're so used to just getting some of these benefits through our employer coverage. Medicare does not cover most dental care. A lot of the dental care that you and I get to a lot of times is like tooth fillings and things like that. Medicare does not cover those kind of things. You would need a separate dental policy to cover that sort of thing once you're on Medicare. Most of your vision care, when you go to the eye doctor and they just, cover one eye and they have you read the chart with the numbers on it, and you have to get your glasses refilled and that sort of thing, that's really not covered by Medicare. Hearing aids and exams. Personal care. And when we talk about this, what I'm referring to is, let's say that you need somebody to clean your house or prepare meals or something like that. That's not a service that Medicare is going to pay for. So let's say that you were in the hospital and you had some kind of surgery and you're able to go home, but maybe you're not getting around too well yet. And maybe someone from home health is going to come in and they're going to do some kind of therapy, or they're going to give you medications or something like that. That's great. Medicare will cover that, but they're not going to pay for that home health agency to clean your house. They're not going to pay for that home health agency to cook your meals or something like that. Nursing home, if you get to the point where you're needing to live somewhere where they're taking care of you, that is not a Medicare covered benefit. Non-emergency transportation. Now, if you've had an emergency, if you're having chest pains or something like that, you call 911 and that's going to be covered. If you've got uncontrolled bleeding or anything that a prudent layperson would consider to be an emergency, that's a covered benefit by your Medicare. But if it's non-emergent transport, if you're just not able to drive and you just need someone to drive you to the doctor, unfortunately, Medicare is not going to cover that. Also, most of the care that you receive outside of the United States. So if you decide to take a cruise or you go over to Europe or something like that, Medicare is not going to cover that. So you might look into travel insurance. If you decide to go on a cruise or something like that, check out and see if there's some kind of travel insurance that you could take out for that trip. Now, when can you enroll in your Medicare? If you're under 65 and you're on disability, that means that you're already receiving your Social Security benefits. You're getting monthly checks from Social Security. So you're already in the system. Now, that means you're automatically going to get enrolled in Medicare. You're already in the system, so you're on the radar. So approximately 3 months before your that 25th month, when your benefits kick in, you're going to get a packet in the mail. And that packet's going to have your Medicare card in it, and probably a little bit more information. And it's going to have you automatically enrolled in Part A and Part B. Now, for some people, they may not want to go ahead and enroll in Part B yet. This would include people, perhaps maybe you are married, maybe you're on disability, but your spouse is still working. And if you're covered by your spouse's employer coverage, you may not want to start your Medicare Part B yet because you've got coverage through your spouse's group health insurance coverage. So you could actually delay starting your Medicare Part B for a while and not have to pay that Part B monthly premium. Right now, the Part B monthly premium is $202.90. So if you've got group health insurance coverage through your employer, you might be better off not paying that $202.90 yet. Save that money, just use your group health insurance coverage. So you can actually send that card back to the people at Social Security and tell them you want to delay starting your Part B. Now, for people who have Lou Gehrig's disease, as we said before, they don't actually have to wait until the 25th month. Theirs starts the first month of their disability. Now, for people who are turning 65, if those people started their Social Security benefits prior to turning age 65, again, those people will automatically be enrolled in Medicare. They're going to get their card in the mail roughly 3 months before they turn 65. And again, it's going to have them enrolled in Part A and Part B. Again, if their spouse is still working and they've got group health insurance coverage through their spouse, they can delay starting their Part B, just like the individuals that we spoke of before who might have been on disability. Now, the coverage for those individuals should start, if they've already started their Social Security, their Medicare should start the first of the month in which they turn 65. It doesn't have to wait until your actual birthday. It becomes eligible the first of the month in which they turn 65. Something to keep in mind for those people who were born the first day of the month. If your birthday just happens to be February 1st, your Medicare is actually going to start the first of the previous month. So your Medicare would start January 1st. Don't ask me why. It's one of those quirky little things within the system. So if your birthday is March 1st, your Medicare would actually start February 1st. So something to just be aware of. Now, if you're turning 65, but you're not currently receiving your Social Security benefits or railroad retirement, I forgot to mention now people who retired from the railroad, they don't get Social Security. They get their retirement through the Railroad Retirement Board. But if you're still working, you're not taking out your Social Security yet. And by the way, it doesn't matter whether you're still working or not. Some people just elect not to start taking out their Social Security yet. They're pushing it off. They want to collect more later on or something like that. If you're choosing not to collect your Social Security or railroad retirement yet, you're not in the system yet. You're not on the radar screen. So you actually, if you want to start your Medicare benefits, you're going to have to reach out and contact somebody. You're going to have to call Social Security or the Railroad Retirement Board to request to start your Medicare. And the time to do that first is your initial enrollment period. The initial enrollment period is the 7-month period that is the 3 months before, the month of, and the 3 months after the month in which you turn 65. Now, if you're not receiving Social Security or railroad retirement benefits, you're not going to automatically be enrolled in Medicare. And I can't tell you the number of people who don't know that. They think that when you turn 65, somehow America just knows this and you're going to get Medicare. It doesn't happen that way. So you're really going to have to be on top of that and know that you're going to have to actually take action unless you started your Social Security benefits. Now, if you enroll during that 3-month period before you turn 65, your benefits are going to start the first of the month in which you turn 65. So if your birthday was in February, and you enrolled in one of those 3 months prior to the month of February, you would now have Medicare benefits. But if you wait and you enroll during the month in which you turn 65, then your benefits aren't going to be effective until the first of the following month. If you wait until after that to one of those following 3 months, it's going to be the first of one of those following months. And here's a chart that kind of illustrates that a little bit so you can see it a little more visually. In this illustration, if, let's say that this person is turning 65 in June. So if you wait, if you use one of those previous 3 months, it's going to be June 1st. If you wait till the month if your birthday was in June, it'll be July 1st, and then et cetera, et cetera. To get enrolled in Medicare, you got a couple of different options there. You can go on the website for Social Security, ssa.gov, and you can actually enroll yourself in your Medicare benefits. You can just enroll in Part A or A and B. You can also choose to go in and talk to someone at Social Security. You can call that number and you can make an appointment at your local Social Security office. I will tell you, folks, they are very, very behind right now. They are understaffed, and it can take a little while to get in. So if that is your choice, if you'd rather just go in and have someone assist you, I would encourage you to plan on making that appointment well in advance. Railroad Retirement Board, folks, there's your phone number right there as well. Now, you can do this online. If you're someone that is comfortable using a computer, there's no reason in the world why you cannot enroll yourself. I will tell you, folks, this is not like ordering shoes on Amazon. There are some documents that you're going to want to have handy. There's some information that you're going to need to have. So I would encourage you, don't wait till the last minute. Take the time, go out on the website, read the information. There's some tutorials, there's some things that you can read. They're going to want some information from you that you're probably going to want to look up ahead of time, such as they're going to want to know your current employer, when you started at that employer, your last date of employment, what insurance you had at that employer, what was your last date that you were covered by that insurance. They're going to need information about your spouse, whether you're currently still married to that spouse or if you were divorced when you were divorced. Just a lot of information like that is going to be required as you are doing this Medicare enrollment. So don't just think you're going to sit down and do this in 15 minutes. I would encourage you, look at the website, find out everything that you're going to need to have handy and at your fingertips so that you can get this done and not be surprised and frustrated when you're doing this. Now, should I enroll in Medicare if I'm still working? If you or your spouse is still working and you've got employer group coverage, you can delay enrolling in your Medicare. You don't have to enroll right now. And you can just use that employer group coverage that you've had all along and not have to pay the premiums for your Medicare Part B, as long as it's for active employment. You're not retired, you're still working, you or your spouse. But it's important before you make that decision, you need to find out, is that employer group coverage considered creditable? Most of it is, but you always want to double check. The other thing you want to make sure of, how many employees does your employer have? If you're turning 65 and that employer has 20 or more employees, that employer coverage can be considered primary, and you can delay enrolling in Medicare. If the employer has less than 20 employees, however, Medicare is going to be your primary coverage, and you're going to need to go ahead and enroll in Part A and Part B. Now, if you're somebody that's under the age of 65 and your Medicare is because you're on disability, those numbers are going to change. You got to make sure that that employer has over 100 employees, not just 20. And if that's the case, then you're going to need to get Medicare A and B, because otherwise your Medicare is going to be primary. Now, if you delay enrolling in Medicare due to job-based insurance, that's great. You can enroll in Medicare at any point in time while you've got that job-based coverage. All right, you don't have to wait to any special enrollment period, the annual enrollment period, or anything like that. At any point in time while you've got that job-based coverage, you can change your mind and enroll in Medicare Part A and Part B. There is a special enrollment period that starts when you lose that employer coverage. It lasts for 8 months. So you've got an 8-month period during which, after that employer coverage ends, you can enroll in Medicare Part B and you don't have to worry about having to pay a penalty. Okay? So it's better if you don't wait that 8-month period, folks, because if you don't have any other kind of health insurance, trust me, that's when something bad is going to happen. So probably better to get enrolled sooner than later. But you do have an 8-month period during which you can get enrolled and not have to worry about it. Now, when you do get enrolled, when you're getting enrolled in Medicare at that point, there's a couple of forms that you're going to need. Social Security is going to want to have two forms. One is the CMS 40B, the other is the CMS L564. The 40B is the Medicare application form. That's the form that they need. And this is like an online form. The CMS L564 is a form that you're going to have to get from your employer. And that's the employer saying, yes, they were an employee of our company. Their last day of work was this date, and they had employer group coverage as up until this date. That's your proof that you had creditable group health insurance coverage up to that date. So you definitely want to get that form and you don't want to wait. Don't drag your feet. Get that form as soon as you can. In fact, I would be getting it as you're going through the retirement process, as you're going through getting all your paperwork filled out with your employer, get it done then. Now, there is a general enrollment period with Medicare. This is January 1st through March 31st, and this is specific for Medicare for people who did not get enrolled in Medicare during their initial enrollment period. They did not have group health insurance coverage. They didn't have other kinds of insurance. They just chose not to get enrolled in Medicare. Um, if you were eligible for Medicare and you just didn't want to get enrolled, because there's no law that says you have to enroll in Medicare, if you didn't get enrolled during your initial enrollment period, and then later on decide you change your mind and you want to get enrolled in Medicare, the next opportunity that you have to get enrolled, if you didn't have other like group health insurance coverage, et cetera, is going to be this general enrollment period, January 1st to March 31st. You can't just enroll at some other time of the year. And you'll probably be subject to a penalty if you didn't have some other kind of insurance coverage. Now, the benefits are going to start the first of the following month. A few years ago, your benefits wouldn't have started until the middle of the year, but that's finally gotten changed. Now you can get your Part B benefits much, much sooner. So that's a good thing. Now, there is a late enrollment penalty. If you didn't take out Medicare Part B when you were first eligible, you will be subject to a penalty. And oftentimes I hear people complain because their argument is, why should I have to pay a penalty? I didn't need insurance. I wasn't sick. That's not the way insurance works. You don't take out insurance because you plan on having a car wreck. You take out insurance in case you have a car wreck. Same thing is true with health insurance. So if you delay enrolling in Medicare Part B and you don't have other creditable coverage, here's what the late enrollment penalty looks like. It's 10% of the current year's Part B monthly premium for every 12-month period that you delayed enrolling in Part B. And that gets added to your monthly Part B premium for as long as you have Medicare. Now, here's an example of what that would look like. If a person delayed enrolling for 2 years, let's say that a person did not take out their Medicare for 2 years, they did not have employer coverage, and then they decide they do want it. And let's say that it was this year that they decided to enroll. Since our current Part B monthly premium is $202.90, multiply that by 10%, that gives us $20.29 as an annual penalty. Since it was for 2 years, the penalty would be $40.58. That gets added to the monthly premium, and that person's monthly premium is now going to be $243.48, and they would pay that every month for as long as they have Part B. Now, again, that's based on the current year's Part B premium. That means next year, when the Part B monthly premium changes, that would be recalculated based on the current year's premium. So again, folks, it's better to get enrolled when you're supposed to. For the purposes of whether or not you can delay your Part B premium, you should understand that there are certain insurances that do not count as creditable coverage. This includes coverage through Indian Health Services, coverage through VA, as well as COBRA coverage from your previous employer. This also includes federal employee health benefits. So if you've got coverage through the federal government as a retiree and you didn't take out your Part B, which a lot of the older federal folks didn't have to, that also does not count as creditable coverage. Now, we're running short on time, but I want to cover these things, so please try and stay with us if you can. The prescription drug coverage kind of depends on where it's being administered for you. So what's going to pay for your prescription drugs kind of depends on where you're getting it. If you're in the hospital and they're giving your drugs while you're an inpatient in the hospital, those prescription medications are probably going to be paid for by your Medicare Part A. But if you're getting medication at the doctor's office, perhaps, or maybe they're giving you some kind of infusion therapy while you're at the doctor, that's probably going to be paid for by your Part B. There are also some medications that are being prescribed to you that are being used through some piece of medical equipment, like maybe like through a nebulizer or something like that, that was covered by your Part B. And those are also going to be covered. The medications that are administered through that Part B covered piece of equipment is also covered by Part B. But anything that your doctor prescribes to you at the doctor's office that you're going to go pick up at the pharmacy is probably going to be a Part D prescription medication that's going to have to be covered by a Part D prescription drug plan. If you're still working and you've got employer group coverage, you can delay enrolling in a Part D plan or through your spouse, and you can keep using that. That's going to be considered creditable coverage. You don't need a Part D plan. But when you lose that employer group coverage, you need to look and see, do I have something else that's possibly going to cover my prescription drugs? This can include Indian Health Services, VA, retirement benefits, TRICARE for life. These are considered creditable drug coverages. While they weren't considered creditable for your health coverage, they can be considered creditable for the purposes of Part D prescription drug coverage. Now, when that employer coverage ends, you need to evaluate that drug coverage, see if you need to get on a Part D drug plan. All right. Sometimes it's good to have a Part D drug plan because it may cover more than what your current drug coverage covers. If there's something that's very expensive, if you've got a health condition that maybe has a lot of needs in terms of the drugs that you might need to take, having that Part D coverage expands the number of drugs that you can have access to, as well as maybe places you can go to get those the prescriptions filled. So you don't have to have a Part D plan, but later on you might need to get drugs covered, and you don't want to be stuck in a place where you can only enroll during that annual enrollment period or be subject to a late enrollment penalty. Now, to have a Part D plan, you do have to be enrolled in Medicare Part A or Part B. You don't have to have both, but you do have to have one or the other. You have to live in the plan service area, but most of these Part D plans have a very big service area. I will also tell you, we have very few Part D plans compared to what we used to have. At one point in time, we had upwards of 20 Part D plans. We now have 11. So they have dwindled down somewhat. You only have 63 days from the time your current drug coverage ends to get a Part D plan. You know, before when we were talking about health benefits, when your employer coverage ends, you had 8 months to get enrolled in Part B. You only have 63 days to get enrolled in a Part D plan without having to worry about the Part D monthly penalty. Now, the Part D penalty is much smaller than what the Part B penalty is, but I still wanted to mention that to you. So, uh, the initial enrollment the enrollment period for Part D, it can be the same as the enrollment period for your Part A and Part B benefits. It can be different. Like, let's say that you're just now enrolling, maybe you didn't enroll in Part A and B at when you first became eligible, maybe you were still employed and so you enrolled later. Then it can be the 3 months before the month of, and the 3 months after when you enrolled in Part A and B later on after you retired. Here are resources. If you're trying to get a hold of Social Security, there's their website and phone number. Again, you can get enrolled on the website. Be patient. You can do it. You might start shallow breathing, but I have all the confidence in the world that you can do it. Railroad Retirement Board, there's the CMS website as well. Now, is that everything? Do you know everything there is to know about Medicare? Oh, heavens no, folks. There's the difference between traditional Medicare and Medicare Advantage plans. There's Medicare supplement plans. What if you'd rather use one of those instead of a Medicare Advantage plan? Where are you going to live? Are you going to stay where you're living now, or are you planning on moving somewhere else? What are your resources? When you retire, there's a lot of things to think about. So we're going to be talking about that at multiple other webinars throughout the year. Also wanted to make you aware, we're going to be doing presentations throughout the year at different sites around the state. There's one that's going to be coming up in Newcastle, March 12th, 5:30 p.m. If you live in that area, if you'd like to attend, it's going to be at the Newcastle Public Library on Northwest 10th Street. Feel free to drop by. But we will also be publicizing, we'll have it on our website. I'll mention them at these webinars and stuff when we're going to have some other things. We're going to be dropping it into our social media. We'd love for you guys to come out and see some of these presentations. Gives you a chance to ask some more questions. These are our agencies that we work with across the state. Some people prefer to talk to somebody face to face and ask their questions. These guys are trained counselors. They can answer your questions and assist you in any way. So, questions?
Okay, so it looks like we did have one question. I think you may have actually already answered this question later in the presentation, Ray, but I am going to read it just so that we can confirm that. But the question was, what documentation will you need to not be penalized for taking Part B later due to having the other coverage?
Okay, that is what the L564 is for, because that's the confirmation from your current employer that you had creditable group health insurance coverage, and it gives the date that that coverage ended. And that is what Social Security will need to confirm that.
Perfect. And then we've got one more question.
Okay.
That question is, you said home health services are covered by Part A and Part B. Is there certain criteria for coverage by each?
Yes. In most situations, it's going to be by your Part A. But we also pointed out that some people may not have one coverage, they may only have the other. So for some people, they may not have Part A. They may only have Part B. So there are going to be some circumstances under which it may be covered by one, but not the other. So that's probably the best way in the short period of time that we've got to answer that question. But you can look it up online if you want something that's more detailed.
And I would say that if there's any additional questions, which I do see a few more have come through the chat, just given our current time overage, why don't we go ahead and have people email you with those questions, Ray? So everybody, map@oid.ok.gov is that email address. And so if you guys want to send your questions there, we will be able to get those taken care of for you.
Okay. All right. And I am so sorry that we went over, guys. I really, really appreciate everybody being here today. I hope you can join us again next month, and I look forward to seeing you then. Everybody have a great day.
And just one quick reminder, because I just saw a question come through. Yes, we do have these webinars every month through the end of the year. And if you visit our website, which is currently on the screen, that map.oid.ok.gov, you can find all the details for registering for the webinars through the end of the year. So we hope to see you again.
Thank you.